Claire Paxman, welcome.
Hello, hello.
Hello, lovely to have you on. I'm so excited about this. So, brand ambassador and director of global training at Paxman.
It's a bit of a mouthful, that one, isn't it?
It's a grand title.
It's a very grand title.
So, I'm going to dive straight in, Claire. First question, why do you do what you do?
Gosh, great question. Why do I do what I do? I have a huge avid interest and investment in helping people through such a difficult time of cancer treatment. And the main driver for me is because when I was 14 years old, I cut my beautiful late mum's hair off when she was going through her own cancer journey. So ever since that, I've just wanted to be able to help people, and what better way to do it than with Paxman.
Yeah. So you were 14 at the time, and that was the instigator for the business?
It was, yeah, absolutely.
So tell us that story, Claire.
Yeah, of course. So my mum was diagnosed with breast cancer, aged only 36, back in the 90s. And like so many people all over the world, the prospect of losing a hair absolutely terrified her. And she was actually offered scalp cooling, which is what it's called. Scalp cooling itself has been around for since back in the 70s, really. People used to have tourniquets put on their heads or bags of ice, and that evolved then into what's called gel caps stored in freezers. So my mum was offered, but it was a primitive, archaic kind of device that she tried, and subsequently, unfortunately, it didn't work for her. So that's when, she woke up in the morning and it started to fall out on the pillow, and so she said to me, "Come on, Claire, can you cut it off for me?" So I literally stood in their bathroom with orange-handed scissors from your kitchen drawer and cut it all off, and it was awful.
Yeah.
It was one of the worst things that I've ever had to do.
Yeah.
And still stays with me now. So, but in my mum's true mum fashion, she could make a joke out of anything and just lighten any moment. And she made a joke, and we started laughing.
Yeah.
But it was a horrible time to see that, and to see your mum so upset, because it was the first time she cried. She didn't cry when she was diagnosed.
Really?
She didn't cry when she had to have surgery. The first time she cried was when she lost her hair. So my dad saw this, and then, being the successful businessman and entrepreneur that he was and still is, he started to ask the questions of, what is this? What's this scalp cooling? What are you trying to achieve? And you understood that it's about cooling the scalp but maintaining it, which, like all of the methods, weren't successful in doing, or they were very laborious, time-consuming for nurses, and very uncomfortable for people as well. So with our family background in drinks dispense, which people may know with BrewFit, my grandfather, Glenn's dad, actually invented the first type of ice bank beer cooler way back in the 1950s.
Really?
So we've been, as a family, the Paxmans, we've been cooling liquids for generations. And so when he got to understand that, it was like, hang on a minute, I can make something. This is what we do now. I can make something that works. So with his knowledge and understanding, along with my uncle, his brother Neil, but the biggest driver was seeing how distressed Mum was.
Yes.
To think, if I can make something that can help others not to have to go through this, then that's what I've got to do. What I've got to do.
What an amazing transition as well. So your family and dad doing cooling beer, to then going through a family tragedy, and presumably then using the essence of that technology to think, actually, the cooling part of this technology could be applied here to make this. Wow.
Absolutely. It's incredible. So proud. Yeah. So proud of my dad and Neil, and what they did to develop that first product, which actually, in this room you're in now with me, Gavin, that one there.
Yes, that's the first one.
The very first model there. So it does literally look like a mini beer cooler, and it had sort of rubber rubber like Teletubby caps and things, but the thing was, it didn't need to have the cap changed, which was a big issue. And also we could work at much higher temperatures than previous methods. But that's when the hard work started for us, because we had, as you've just said, we had the understanding and expertise in cooling, but not in a med tech industry, and also limited understanding of oncology. So
how, as a family, and for your dad as well, there's 4 of you, isn't there, siblings?
Yes.
How do you navigate grief and also transitioning into a new business?
Gosh, that's a good question. That's probably one more for Glenn, for my dad.
Yeah.
It's just because we were all still very young. I think so at the time when Mum passed away in 2000. So the business Paxman was already established then. So she did get to see it. She actually got to try it.
Oh, really?
Yeah, bless, because she went into remission, but then sadly and unfortunately a cancer reoccurred, and this time it was diagnosed as secondary breast cancer. So the Paxman systems would started to be distributed then, and the first one being up at Huddersfield Royal Infirmary. Yes. So when she was going through treatment again, she did actually get to use it. Unfortunately, again, it didn't work for her, but that was just because of our limited knowledge back then, but also the incredibly strong chemotherapy regime that she was on as well. Yeah. But in the interest of trying it and testing and innovation, she continued to use it even when she'd lost her hair. So it did start to grow back a little.
So she was one of the very first patients of users
of using it.
Wow.
Yeah, she was. Yeah,
that's amazing.
But yeah, in October 2000, she sadly passed away, aged only 44, which is absolutely no age. So I was 22. Richard and James were only 18, so they were still at college. And then Curtis, our eldest, brother, he was in the business. I was in Brewfit at the time as well. So yeah, I mean, it was really hard to, like anybody that's lost anyone, to come back to work and continue. But it was only Dad at the time that was working on Paxman as well and developing that. So, and I guess that the fact that she was no longer here was a big driver for him to make it a success.
Yes, well, I suppose that grief can be then transferred into fuel almost, can't it? And energy to that it doesn't affect someone else in the same way. And
absolutely, yeah.
And I feel like that energy is still with the company now.
Oh, massively. So we never forget the foundations and where Paxman came from, and never forget my mum. She's the reason we're all here. She's the reason that hundreds of thousands of people now all over the world get to access to Paxman and get the opportunity to retain their hair, or the fact that we can now prove that scalp cooling also improves regrowth. The hair grows back thicker and faster when you scalp cool. So, and all of that is my mum's legacy.
It's just, Before I came this morning, I'd watched a video on your website of your mum, and it was the most beautiful video with music, and you must go, anyone listening must go and watch this video, because the music, but also the footage of your mum.
Yeah.
On holiday.
Yeah.
And in and around the house, and it was gorgeous video.
Oh, well,
and
thank
memory.
you.
And to have that on your website now, 25 years later, and it's clearly still the energy and the reason why, a big part of the reason why, like you say, you're so successful.
Well, part of our, obviously I look after the training and responsible for the training of the business, and it is actually part of our training. So if you're a clinician receiving training from a Paxman representative, wherever you are in the world, or even one of our distributors, it is the opening part of the training. Everybody gets told about the story, and actually just about to start implementing where we're going to have tablets so that we can show that video. Because with the training programs that I deliver, that's part of it, is that video, and it always has such a huge impact. And people can then physically see her and see who she was, and as we call her, our original pioneer.
What was she like, Claire? What was your mum like?
Oh gosh, she was just brilliant. She was one of those people that she'd walk into a room and she would literally light it up straight away. Beautiful smile, just fun, so fun. Honestly, we have, and I always do this with the boys, and just and with Dad as well, as a reminder. I always, they say I'm a bit weird how I kind of remember everything from when we were younger, which is wonderful now, because I can relay and remember the stories. But some of the funniest things was the silly names that she had for things around the house. So the bath was a basil crat. So go and get in the basil crat, and the washing machine was a wazzle crat. Can you just go and get the clothes out the wazzle crat? And and the
a language innovator.
Absolutely. But yeah, she when she was in remission, she became wanted to look after herself a lot, which is understandable. So she used to go to the gym and do classes, and she had like a set of friends that she would go with. And one of the moves was a spotty dog. So she'd be there in the kitchen cooking tea, just doing these spotty dogs time. And so
she was memories though.
She was just brilliant, and she was so courageous and brave going through her treatment, because it was grueling for her, and she was still only young. Like I say, 36 with 4 kids and going through cancer treatment, and she just never moaned and she just got on with it with this beautiful style and finesse, and just wow. She's my I miss her dearly. I miss her so much, and I'm absolutely heartbroken that she didn't get to meet any of her grandchildren, because that's all she wanted to be, was a grandma. So yeah, really, that's the thing. One of the things I'm most devastated about.
It's so sad, but it also gives me like a shiver, hearing about your mum and what she's like, and how you guys as a family have transformed that grief into this, which is amazing. Yeah. Tell us about the company now then, Claire, where you are as of today.
So in 2024 now, aren't we? Goodness me. So I'm really, really proud to sit here, Gavin, and say that we are the global leaders in scalp cooling. We are distributing to over 65 countries worldwide now. Here in the UK alone, we have well over 1,000 systems. We've got over 5,000 systems out there worldwide.
Wow.
In the UK alone, we're in about 99% of public and private hospitals. We can provide chemotherapy at home here in the UK as well, where patients are having their treatment. In the US, our biggest market and the biggest growing market is the US. So we got FDA clearance for the US in April 2017. And now we have, again, well over 1,000 systems out there. We're in over 41 states, in over 500 locations, and we've treated well over 15,000 patients.
Unbelievable.
And most recently, we now have insurance coverage in the US. So that's where it's a real game changer for us, because we want to make sure, we want to democratise scalp cooling. We want to make sure that it's available for everybody, no matter who you are, where you are in the world, what gender, ethnicity, cancer type, and your financial situation.
Yes.
That you get access to scalp cooling and get access to Paxman. It's been out of pocket in the US, so they have to pay for the treatment. But now with insurance coverage, it makes it so much more accessible. So that's one of the biggest things that we're doing at the moment is moving all of our existing hospitals, the facilities, onto what we call our buy and bill model.
Yeah. So I read that stat earlier. I'm looking at my notes now. 98% of NHS and private hospitals in the UK use it.
Yes,
which
correct.
is incredible.
Yeah.
And then the coverage you've now got in America. So in the UK, it's part of your NHS treatment.
It is, yeah.
So it's free for the patient.
Yeah.
In the US, obviously different health system.
Yeah, absolutely.
Previously, the patient had to pay to use the system.
Yeah.
And am I right in thinking it used to be around $1,500 for the patient to?
It would, yeah. It depends on how many treatments that they had. So, but the maximum that they would pay is, or a maximum they would be out of pocket if they had to have 12 cycles of chemotherapy, or more. The maximum they would pay would be $2,200.
Right.
So on average, if you were having like 6 cycles, you'd be paying between $1,600 and $1,800.
Yeah.
So that's what they would be required to pay. We have got lots of fantastic partnerships with foundations in the US. One in particular, a national one called Hair to Stay, and they have been and still do fund scalp cooling for patients, but you have an eligibility criteria.
Yeah.
We also have the Paxman fund, obviously dedicated to mum, and that's to help young mothers who have to go through treatment. So we help. It used to be 2, and I think we moved it up to 4 during COVID, and I believe we've retained that.
Yeah.
So 4 mothers a month will get free scalp cooling.
Wow.
Again through the Hair to Stay project and in mum's memory
in America
as well. In America, yeah.
Got you. Yeah. But the idea with this new initiative then is to reduce that cost altogether for the patient, if possible. Yeah.
So in America, like we have the opportunity to have private healthcare. That's standard in America. Every person in America has to have medical insurance. It's an absolute minefield, to be honest with you, out there.
What's it like being launching in America?
Yeah, well, it took...
Hard.
I mean, it took a number of years. There's a lot of SME medical device companies who stay away, but, you know, again, with our goal of wanting to make sure that everybody has access to this, and it being one of the world's largest healthcare markets, we had to do it. Yeah. We had to do it. So there was obviously a large investment requirement. We needed to upgrade the model of the device to ensure that you could actually have pay for use. So it has a token on there. And obviously we needed to do a trial, a multi-center trial. So the multi-center trial lasted 5 years. So it was and you only have to ask Rich. He was working on this for a long, long time before we got the clearance.
Yeah. This is Rich, your brother, who's the CEO.
Yes, introduce my wonderful brother. Rich Paxman.
Are you the eldest of the siblings, Claire? Or?
No, I'm middle. So I'm middle child and only girl.
All right.
No hope. No, I'm older than Rich.
My guess is you keep them all in check. Yes, exactly.
I don't keep them all in check. No, not at all.
You don't?
No, I honestly, you would sometimes think that I was the youngest because they all. But it's nice. My brothers look after me. But no, I love the fact that I get to do this every single day with Rich. You know, he's an incredible CEO, now OBE, Richard Paxman OBE, which again was such a proud moment.
Yes.
Last year, I say that now, for him to receive.
Well, let me just talk to you about that relationship you have with your brother, and then we'll go back to breaking into America if we can.
Yeah.
So I read earlier something online where you were talking about Rich, and you clearly have a very close relationship, where you'd said giving me, as in you, the confidence when my head says otherwise.
Yes.
Which was lovely. Just tell me about the relationship you have with Rich then, and in work, out of work, how it works.
Oh, I love that. I love that you're asking this. So the reason I said that about when my head says otherwise is I'm very open about the fact that I live with a mental health disorder. So I have borderline personality disorder. Every day is a struggle for me mentally. But, you know, I'm so proud to sit here today and say I'm doing fantastic, with the right medication and therapy. But I have to, I do have struggling times. But Rich has just been incredible because, it's very difficult when he is my boss at the end of the day, but as well as my brother. But he'll always say, I'm not going to be sort of your boss in that sense, because he finds it very hard, but he deservedly so, is the CEO of the business. He's absolutely incredible. He's a fantastic mentor, and he has got the biggest heart. He really has the biggest heart, and he genuinely cares, and not just for me, for everybody, all of our SLT, every single person that works in our business. He's got the time for, and he's so approachable. But for me being his sister, he's not only my brother, he's my best friend.
Yeah.
And else, and I feel the same about all my brothers.
Yeah.
But Rich and I have had that relationship over the years. I lived with him in Manchester when he was at uni, and before I had my son, and so we did used to socialise and go on holiday together. So it's but he is my rock. He really is, and he's guided me and helped me and supported me being a sole parent as well. As have all the family.
Yeah.
I'm very lucky, and I think we portray that when people see that we are a close, good family, and it's all been grounded and rooted from Mum. So
well, we've worked together for a number of years as businesses, Howarths and Paxman, but even just this morning, as we were setting up for this podcast, Rich came in to say hello, and you can tell the interaction between you two, and it's genuine, isn't it? It's real, like a family business. But I feel like with values and family relationship first and business second.
Yeah.
Is that fair?
Yeah, definitely.
And has it always been like that?
Not always.
I mean, you'll have had your moments, I'm sure.
But absolutely. And I think it'd be wrong of me to sit here and say that we haven't had difficulties or disagreements. I mean, sometimes we have that around the boardroom table for Brewfit, because Rich and I actually do sit on the board for Brewfit as well. Yeah. So, it's and there is times when it's been difficult, and perhaps the business has gone, come first before. But then we're all so different in our personalities, which helps and we all bring different qualities. And I think as we've grown and you learn that, because we've all been doing this from a young age. I mean, I've been with both companies now it'll be 26 years this year.
Really?
Which is crazy. It's older than some of our our team members out there. It's like, oh my God. So, that sat round a table together in our 20s and 30s, you know yourself. Yeah. You have to evolve and grow yourself as well, and learn about you. And develop as a business person. So we've kind of done that together. Yes. If that makes sense.
It does, makes complete sense to me, because
and that's where it's wonderful, because you can just see that we have all then migrated into these different roles, although managing director, CEOs, but it's wonderful.
It takes time to get there, doesn't it?
It does, yeah.
And some tough conversations, and probably a little bit of door slamming along the way.
Absolutely, yeah.
But you can't avoid those. No. You've got to have them, front these things up, and ultimately find your place, I think, don't you, in the end? Unfortunately, it can fracture a lot of families, can't it?
It can,
I'm sure you've heard of examples of that. I have as well. But to keep the family together and tight, in the context of a successful commercial enterprise, where money's involved, putting it bluntly, it's not easy, is it?
No, it's not. But I think,
and for you guys having such a significant family event, in the passing of your mum so early on. Yeah. I mean, you could look back and say a lot of other families, like you've done so well to keep it all together. And I know Glenn as well, and you're just such a brilliant family. But I imagine for a lot of families that would have torn them apart. Yeah,
I think it can and it does. But I think that's, where we talk it out, and at the same time, and as I just mentioned before, Mum is in our thoughts all the time. Yeah. And just say, what would Mum be doing now if she saw us like this?
Is that what you say?
Yeah.
Will you say it out loud? What would Mum be doing now, or what would Mum think?
What would Mum think? Yeah.
Wow.
Absolutely.
Where do you have these?
She won't be having any of this.
You'd be getting a clip.
Blooming, won't you? Clip round your ear, old lad.
Is there a place you go to have these family discussions?
No, not really.
No.
They're usually in a meeting room, but
Yeah. Is that why you've got big tables? So there's a bit of distance?
there's a bit of distance. Now you sit there and you sit there.
That's great. Okay, right. Let's go back to breaking into America. So you build up a successful business in the UK. Are you in 98% of NHS and private hospitals in the UK before you go to America? Or they're running concurrently? Those?
Okay. we built that. The UK is kind of like being the base to allow us to expand elsewhere. We were already in a number of European countries as well. It's the last 5-10 years which has been where we've seen the biggest growth.
And so for anyone who doesn't know this, which includes me, if you're aiming to go into America, and like you said earlier, Claire, you're a medical device, so the standard of scrutiny is going to be exceptionally high.
Yeah.
From the very first time you decide as a family, we should attack America because it's the biggest medical market, we're going to go for it. To actually making that thought a reality, how long is that period?
So I believe that Rich and Dad, because Dad was involved in the business, but mainly Rich was started to look at America, I believe, sort of 2000 and I want to say about 2008, 2009. So like 10 years before, or just less than 10 years before us actually getting that official approval.
So before your first Paxman machine is used in the US?
Yeah, because we had to do... So we're governed by multiple regulatory bodies, medical device bodies. So that's why we have... Now, our quality department alone has 7 people in it, because you need that to adhere to all of the different regulatory requirements. So Japan's got its own, America's got its own, Europe's got its own. There are different regulatory bodies that we have to adhere to all over the world.
Yeah.
The FDA is the one of the hardest.
Is it?
And the most difficult and stringent.
Yeah.
And so, it was about looking at the market, how it was going to work, but then having those conversations, right, what do we need in order to gain this FDA clearance?
Yeah.
Even though we got years and years of European data, that wasn't suffice for them.
Really?
So they needed their own data and trial.
Yeah.
So then that was the next thing. That's what we had to do, is to set up a trial in the US.
A multi-year trial of sufficient size.
Multi-centre. And multi-year trial,
Wow.
Yeah.
To present the evidence, even though you might have had a decent amount of evidence already.
Yeah.
The FDA want their own.
They want
you
their
have
own.
to go about doing that.
Yeah, they want their own US
It's
data.
amazing, isn't it? 8 to 10 years from idea to getting the first machine used in America.
Yeah.
It's quite a journey, that.
And obviously lots and lots of investment.
And the money.
Yeah.
And the staying power to not think in year 3 or 4, you know what, should we actually just try something a little easier?
Well, those conversations were hard. Is this, are we pushing ourselves? Are we going to be able to do this? But again, right, no, mum in our thoughts, and also we have to make this available because it wasn't in America. That was the thing,
Right.
Even the previous caps of that are kept in the freezer, those were what people were using, again, paying for them themselves, but they weren't offered or facilitated by the hospitals. It was patients bringing them in themselves.
Really?
Yeah, which they still do in the centres that don't have ours or our competitors' device.
Yeah.
It was like, come on, we can do this. Let's not fall at our hurdles. Let's make sure that it's available.
Congratulations. I mean, what an achievement. You still must look back now and think about the Paxman machine from Huddersfield in all these states in the US.
Oh, yeah.
And think, wow.
I mean, I love it. I mean, one of my biggest things, and hence my brand ambassador role, is not only facilitating the training programs that I've developed, but I'll guest speaker. I've been on, in fact, I made my first US TV appearance last year. I was on Zoom, but and radio as well, or I'll talk at events. And a lot of the time I'm presenting about Paxman, and I love to talk about the fact that I'm from Huddersfield. I'm so proud to be from Huddersfield. Love it here. And so it's a really good thing to sort of open by saying, so how many of you here have heard of Huddersfield? And you expect like, no, Huddersfield? Oh my God, no. And you get this, and you might, every so often though, I do get one like, yeah, you were in the Premier League. I'm
going to say there must be.
You might be a taxi driver or something like, oh, Huddersfield, yeah, you guys were in the Premier League. And it's like, yes, I know. But then I'll sort of say, does anybody watch Game of Thrones? And so I'll throw in the Lena Headey.
I don't know
link.
This one.
What?
I don't know this one. Tell me the Game of Thrones link.
Oh my God! How do you not know this? This is ridiculous. So, so Lena Headey. Did you watch Game of Thrones?
No, I have not even watched it. I know.
Right.
Sorry.
Well, that's disgraceful.
We should end this right now.
Yeah, end this podcast right now. And that's your homework to get through 8 series of the Game of Thrones, which is absolutely brilliant. So yeah, one of the lead characters in that. She's a famous Hollywood actress, Lena Headey. She's from Huddersfield.
Ah.
Yeah. So the last time we went to Wembley, I was sat next to her dad. So we're friends of the family. Jeff Headey, who used to be one of the directors at Huddersfield Town, is her uncle.
Is there Patrick Stewart from Huddersfield?
So Patrick Stewart is from Dewsbury. So it's a tenuous link, but I still bring that one up as well.
The Kirklees area, the wider Kirklees area.
Yes, exactly. So I always say Patrick Stewart, Huddersfield, and so all these like little links. Does anybody like BBC dramas? Have you watched Doctor Who? The last Doctor Who was from Huddersfield, and both of those two went to my son's school. But it's nice to do those links, but it's mad. You do have those pinch me moments.
I can imagine.
Really do have pinch me moments. And especially things, I said it the other day about, again, back to TV, but Grey's Anatomy, and watching that all over the years and hearing all these hospital names, Duke, MSK, all of these, and MD Anderson, and they're now our customers.
And you're there.
And we're there.
Wow.
And Paxman are there. This little family from Huddersfield are helping all these people all over the world.
It's amazing.
Brilliant.
It really is amazing. Let's talk a little bit about the science of it, Claire, because I'm intrigued by this. Because we have some personal experience in our family because, as you know, my dad was diagnosed with bowel cancer and had chemotherapy. Yep. So the hair loss didn't happen, and it wasn't a big feature of Dad's particular journey. Yeah. But it clearly, everyone knows, on a chemotherapy journey, the hair loss can be really significant. It's just such a big thing, isn't it? So the cooling cap, how does the cooling of the scalp work? Yeah.
Okay. So the reason so not all of the chemotherapy drugs cause hair loss.
Okay.
It depends on how they're targeting that cancer. So, but the ones that do, and the majority of them do, that cause hair loss, the reason that you lose your hair is because your hair follicle, the cells in your hair follicle, are rapidly dividing cells. So 90% of the time they're in their active growth phase. So that's why your hair grows.
Yeah.
So a cancerous tumour is also a rapidly dividing cell. So it's constantly growing. So many chemotherapy drugs are designed to target rapidly dividing cells. But the only problem is they can't differentiate between a nasty cancerous cell and a healthy cell.
Yes.
So it just targets them all. So that is why you lose your hair, because it basically causes the cells in the hair follicle to die and the hair falls out. That's why some people get mouth ulcers, because you've also got rapidly dividing cells in your mouth. Some people suffer with the nails and stomach as well, because you've got rapidly dividing cells in your stomach. So that is ultimately why you lose your hair.
Okay.
So how scalp cooling works is we are trying to protect those cells against the effects of the chemotherapy. So what we're trying to achieve is getting the scalp temperature down to a temperature of about 18 to 22 degrees, which is warmer than it is out there today, which sounds a bit strange when you're talking about a cold cap. But the fluid that flows through the cap is a minus figure, minus temperature, sorry. But the temperature of the scalp is about 18 to 22 degrees. And there's a number of biological processes that happen and that occur. So the first one, and the most commonly understood and what people have been trying to achieve, is vasoconstriction.
Yes.
So what that does is it narrows the blood vessels, and it means that less blood carrying the chemotherapy gets to those hair follicles. So, if you get a sports injury, what do?
Ice.
Yeah. So that's exactly the same reason. It's to restrict the blood flow. So it means that less blood is getting to those hair follicles in the scalp. So it lessens it by about 20 to 40%.
Okay.
Yeah. So less chemo getting to that hair follicle.
Yeah.
So the next ones and what we've discovered in our biological research in collaboration with the University of Huddersfield, we've actually found that if you lower the scalp to this 18 to 22 degrees, the cells, they stop rapidly dividing.
Right.
Yeah, so they kind of lay dormant. They kind of go to sleep, hibernate. And therefore, if they're not rapidly dividing, the chemotherapy bypasses because it's looking for a rapidly dividing cell.
So the reducing of the temperature would in theory stop the hair growing.
It's not that only in that period of time when you're having your treatment. Yeah. So it's just when basically you wear the cap for 3 stages. It's pre-cooling, which is usually 30 to 45 minutes before you have your chemo. Then it's during your chemotherapy infusion, and then you wear it for a period of time after, which is generally 90 minutes. That's when the chemotherapy is most active in your system. So it's not going to stop your hair growing because it doesn't sort of grow within a 3.5 hour period.
Yes, it almost like pauses the cell activity.
Yeah, exactly. That's a perfect description. It does, yeah. So those rapidly dividing cells stop rapidly dividing, which therefore means that the chemotherapy bypasses it because it's because it's searching out for those rapidly dividing cells. What we've also found as well is that the cell wall, the cell itself, becomes protected. It actually stops the transport of the chemo getting into that cell. Okay? Wow. So I sort of liken it to like it grows a bouncer. Your name's not down, you're not coming in. Yeah? Get out.
You're right, brilliant.
Yeah, and then we also know that what we say is like the actual chemotherapy, the toxicity of it is lessened because it's being cooled just in that localized area as well. So there's a number of different biological mechanisms that occur, and all of those are making it so that it's protecting. So cryoprotection of that actual hair follicle.
Is there a difference in gender between male and female on the application of the treatment?
No, it's exactly the same. I mean, obviously, if you're referring to the fact of that male, for male pattern baldness and different things, that's a different process of why you lose your hair. Chemotherapy-induced alopecia is the same whether you're male or female.
Yes, understood. Yeah. And tell me a little bit about where the business is going in terms of new initiatives. Yeah. So CIPN, I'm interested in. Let me have a go at see if I can pronounce this.
Oh, I
messed it up before, didn't I? Chemotherapy-induced peripheral neuropathy.
Woohoo!
Got there.
Yes! Gold star to get.
Thank you. CIPN.
Try saying that when you've had a few glasses of wine.
Yeah, exactly. No, I don't. The reason I'm particularly interested in this is, again, just to refer back to Dad having bowel cancer and going through chemotherapy, which, by the way, is horrible, isn't it? The whole process of chemotherapy is horrendous. I felt like this was something that specifically applied to Dad's case. So can you just explain exactly what that is?
Yeah,
first?
Of course.
The peripheral neuropathy.
Neuropathy, yeah. Yes. So there are certain drugs that you have particularly in the taxane family, that cause this peripheral neuropathy. And it's basically where it damages the nerve endings in your hands and your feet. So there's, again, it's different gradings of it, but the severity of it can be with the fact that people struggle to walk. You get a tingling sensation. Yes. And sometimes people find it difficult to grip and hold on to things. It's so debilitating. And the massive issue with it is that it's irreversible. Once you've got it, that's it. It doesn't, unlike with your hair, it grows back. With peripheral neuropathy, it will. It's lifelong. So it's and there currently is very limited treatment for it. What they do now is they'll actually, if people start to get it to severely, they will reduce the dose of chemotherapy, which again can have an adverse effect as well. So
So how are you intending to tackle that at Paxman?
Yeah, so we have we've now got a new device which is called the PLCS, which is the Paxman Limb Cryocompression System. So we've been working with the University of Singapore for a number of years now, who have been researching and working on this for the last 10 years, of how you can treat it. And it's actually been discovered that not only with cooling, but actually compression. So at the moment, what there is available is people have these gloves and mitts that they wear, and again, similar process to the old style of gel caps for the head, where they're stored in a freezer and then you wear them.
Yeah.
But again, the difficulty with them, because of not being able to change them, or them being too cold and not being bearable to wear directly on the skin. So what the guys at the University of Singapore, as I say, discovered is that actually if you can cool at a much higher temperature, but also if you apply compression at the same time, but you can actually, this can be higher up the arm as well, not just concentrating on the hand. So then they approached us, being with our expertise with the Scalp cooler.
Yeah,
and we've been working with them now for the last few years, and we've developed this new device.
Wow.
So they've been trialling it in Singapore for a while now. And then last year we launched our, it's not our trial, but a large trial in the US was launched on the device. So there's 25 sites who are trialing the device with looking at it with different arms to it, excuse the pun. But it's basically two separate devices, one which operates the arms and one which operates the legs. And then the patients wear these wraps, big Velcro wraps, which are channeling both cooling and compression through them. And again, they wear it for a period of time before, during and after the taxane chemotherapy.
And the idea is that this is stimulating the nerves.
It's protecting the nerve endings, protecting the nervous system against the effects of the chemotherapy.
Yes.
Yeah.
Yeah.
So
to reduce the likelihood and symptoms of
the peripheral neuropathy. Yeah. So the obviously it's very early days for the trial in the US. However, the trial in Singapore is been very successful so far, and 30 plus patients have been treated, and all with no dose reduction. Yeah, which is absolutely what we're looking for.
It's amazing. It's amazing. Yeah. Just zooming out a little bit, Claire, on the perspective of cancer. So I read earlier that there are 80 million. Let me check my notes. 80 million new cancer patients every year. Mm-hmm. Chemotherapy appears to be a very harsh treatment. You know, the way you were talking about it earlier, it can't distinguish between good cells and cancerous cells, or the quick dividing ones, and it'll just kill everything. Yeah. Clearly the work you're doing to reduce the symptoms of chemotherapy is incredibly important, whether it's hair loss or the symptoms we talked about earlier, the CIPN work. But Do you have any insight on chemotherapy as a treatment to cancer? Like, is that going to continue? Is it a thing we've got? Is it the best we've got at the moment? Do you have any insight on that area?
So the chemotherapy has evolved massively. So what people have to realise and understand as well, cancer evolves all the time. It's not the same cancer. So when my mum was being treated, the cancer it's such a nasty, clever thing that it actually, I'll tell you what I liken it to. So, which has made everybody understand things a little bit better.
Yeah.
So look at COVID.
Yeah.
Yeah. So COVID, we had, and we now have multiple strains of it.
Yes.
Because once you've managed to tackle it one way, it develops and evolves into another strain. That's just, and I am no scientist here, so this is just very, very basic of how I'm trying to get people to understand. So that's the same with cancer. It is constantly evolving and changing into a different type and form.
Got you.
But what the pharmaceutical companies are doing, so they are constantly, evolving with the chemotherapy treatment. So there are also lots of fantastic, amazing new chemotherapy drugs, and more targeted therapy as well. So it's a mixture of chemotherapy and then also targeted therapy, where you can actually then, rather than it being everywhere else, where you can actually, it just targets that particular cancerous cell.
Yeah.
You've also got monoclonal antibodies, which again is another form of treatment, and the hair loss isn't as severe with that. So they are constantly evolving with treatments. But what you've got to understand is the length of time it takes for these to come to market.
Yes.
So from that initial inception and idea in the lab to then having an actual product, to then doing clinical trials with it, it's a long time. Yeah. It's a long time. Yeah. So they are. We're at these huge cancer conferences, whether it be, a lot of them are in the US, and then we have the European ones as well, and it's incredible. For example, like a product called Inhertu, which was launched the other year at San Antonio Breast Cancer Conference, which is a fantastic drug for people with secondary breast cancer,
right,
and can prolong and really help with their treatment.
And the idea for that new drug may have come about 15 years ago, maybe around that, longer, but it's only now that it actually comes to market.
Yeah, because there is the huge, the length of time it takes to develop.
Yeah.
And then all of the testing and the clinical trials and everything like that is. I
think it's really interesting to hear that, because cancer unfortunately touches us all, doesn't it?
It does.
One way or another.
Yeah.
And it's just devastating and very insidious, like you say. It evolves, it changes, it seems very hard to target. It's just devastating effects on families. And we all live in hope that there will be a cure at some point. But actually, to understand from someone who is in the know about...
Limited in the know. I'm not in the know. I'm not a doctor or a scientist. No, but I do. I do have my understanding of it in that sense.
Of the reality of getting there.
Yeah, absolutely.
Yeah,
absolutely. But there are some people, some fantastic, very clever scientists doing some amazing work all over the world But the one thing I will say to that, more people are surviving. And that's the key thing here, that yes, we haven't got a cure, whether we will ever have a cure, but with the treatments that are available, more people are living and surviving with cancer than they ever were. It's detection.
Yes.
That's the key thing. So, if there's anything I can say on this podcast to people now is be mindful, ladies, check yourselves.
Yeah.
You know, any differences that you notice, alert, you know, because it's the early detection which saves lives.
Yeah, the earlier you get it, the better.
Don't sit on something that you're a bit worried about. You know, I know our GPs are stretched, but it's your life. So
yeah. Without
self-advocation.
Yes. Yeah, it's very empowering, but I mean, without generalising hugely, I feel like women might be slightly better at taking action than a certain generation, let's say. My dad being one, I don't think he'd mind me saying, but it took him a while to, face up to the fact that there could be something wrong here, and then go to the doctor, and get the diagnosis.
You don't get any awards for being, for being somebody that's, I'll be fine, I'll be all right.
Yeah,
it's really important to, if something's not right, it doesn't harm you at all to go and get it checked out.
What does the future look like for Paxman then? So where will you... what's the ultimate aim with what you're doing is to try and get the product everywhere as far and wide as possible. And like you said, democratise
Absolutely.
access.
Yeah. So the future is incredibly exciting. Really is. With the further developments with the Scalp cooler, we've got a wonderful R&D department now who are working on new cap, better fitting cap, because and also making it environmentally friendly as well, and biodegradable, all of that kind of thing. We're keen on the environment, but the better the fitting of the cap, the better the success. We've got the topical agent that we've been working on at the university, which, we've got the next steps of that, which again improve the efficacy, growth, continuation of growth. And it is absolutely, we want scalp cooling to become synonymous with chemotherapy. If you have chemotherapy, you have scalp cooling at the same time.
Yeah.
But making it accessible for everybody. Yeah. As I mentioned earlier, that, no matter who you are, where you are, what your financial position is, you get access to it, and it's incredibly exciting in the US with the insurance coverage. That's huge for us. And then of course with the new product, currently in trialing stages. So commercialization of that is looking like potentially 2026 onwards. That's when we'll be looking at commercialization, which again, we're just working through all that at the moment, because that's another. It's a massive asset to the business. It's going to be, it costs each individual that gets peripheral neuropathy. I'm going to hope I don't shoot myself in the foot now, but it costs. For example, even like the NHS or any facility, it costs them between around £35,000 in treatment per patient.
Really?
Yeah.
So the cost saving.
It's a huge cost saving. Yeah.
And do we need the cost saving at the moment for the NHS?
Absolutely. So yeah, it's very, very exciting. There's lots going on. We're all so busy, but we love it. We absolutely love it.
Well, I was going to ask you about that. So what about you, Claire, personally? Are you as invested in the journey as you ever were back when you were, the beautiful story you told earlier when you were 14 and with your mum, and tragic, but the way you told it and the memories and being involved in the business, you're 26 years on now in the business. Are you still as invested as you always were and love the business? And
oh God, yeah.
Yeah.
This is not a job for me. It's my passion. It's my life. Sometimes that passion overboils a little bit more than what it should. But yeah, no, it's as I was when we were just chatting off podcast before. My son Benji is 20 this year. Is fingers crossed joining the RAF. I've raised him on single-handedly, all by myself. So this is my time now. Really, I think the world's my oyster, not just personally, but business-wise, because I've no limitations. I can go and do what I do best as well. So yeah, the hunger is absolutely there, and the passion, and yeah.
Oh, I can feel it.
I'm excited.
I can feel it.
Well, really,
I'm
excited.
It's very empowering, isn't it?
Yeah.
It feels very empowering.
Yeah.
And the mission is clear, and the passion, the energy, but also for you individually. I mean, what an achievement after everything you've been through, you know, and you're kind enough to share it today. But the story from the beginning, 14 is a very difficult age to lose your mum. Yeah. And then your mental health challenges, raising a child on your own.
Yeah.
You're an inspiration, Claire.
Oh, bless you. Thank
you.
You
Are. You are.
Thank you.
And, you know, and maybe that's a good place to wrap up, is to say thank you for joining us on the podcast. And also thanks for allowing us to be a small part of the journey. Howarth and Paxman have worked together for a long time now. 2 families from down the road in Yorkshire, aren't we?
Yeah, no, and it is, and we can't thank you enough. You know, the partnership and the friendship that we've got, it's been invaluable over the years, you know, especially at the rate that we've grown.
Yes.
Yeah. So massive thank you to you for everything that you have done to help with Paxman and Brewfit. And thank you for inviting me to be on the podcast and allowing me to share the story of Paxman and share my own story as well.
Loved it.
Really means the world.
Thanks, Claire.